We're back with our 9 Health expert, Dr. Payal Kohli, this morning. So you were talking about a very interesting new study that's linking vitamin D and a lower risk for melanoma.
Yes. So what it found is that people who regularly took vitamin D supplementation had a lower associated risk of melanoma. And it's not clear whether it's an association or a causation. So that's what I really want to emphasize here, because does vitamin D cause you to have less melanoma, or is it the fact that the vitamin D is a marker for some other behavior, like perhaps you're spending less time in the sun, or taking better care of yourself, or watching your nutrition a little bit more, and that's one of the reasons for lower risk.
And being clear here, you're saying like taking vitamin D, not like soaking up the sun. Like
That's
there's
exactly
a distinction
right.
here, because you obviously get vitamin D from the sun as well.
And especially here in Colorado, you know, we have one of the highest per capita rates of skin cancer because we're a mile high, we're closer to the sun. So we get that UV exposure. And vitamin D is a very complex, you know, chemical in our body that's very important, but it's actually activated from sun exposure, to your point, Erica. So you actually have to spend some time in the sun for your body to activate the vitamin D, and your kidneys and livers and all the other organs sort of participate in that. But what we're talking about in this particular study is actually taking pills, taking vitamin D supplementation. Now, of course, we can get vitamin D from fortified foods as well, you know, milks and cereals and such. But whether vitamin D pills can protect you against skin cancer and other types of cancers has really become a hot area of research.
How much vitamin D are we talking about? How much should we be taking in supplements?
You know, it's different based on your age, but we're really not getting enough. That's the bottom line, because most of us spend most of our time indoors, and then we wear that sunscreen as we should, which can also affect vitamin D absorption. And what's really interesting is it's not just, you know, how much time you're spending in the sun, but the color of your skin, the temperature of your skin. So in summertime, we actually absorb vitamin D better, or we activate vitamin D better than we do in the winter.
Interesting.
Yeah, it's your age. So how old you are can affect how you sort of metabolize vitamin D, and then of course the sunscreens and things like that. So we should, you know, really be targeting at our age about 600 IUs, international units.
Sounds like a lot.
It is a lot. And it's not something we generally always get from our food. So what I tell my patients is check your vitamin D levels, and then really titrate your vitamin D supplementation to try to keep your level around 40 or higher, your blood level. And that's because that's been associated with a lower risk of cardiovascular disease. And ladies, I get patients every day in my office, young, healthy patients who think they're doing fine, and I check their vitamin D, and it's like single digits, like 9 or 12.
It's super common here for some reason.
Well, it is because we spend a lot of our time indoors. We wear a lot of that sunscreen like we should. And then I think as a population in general, we've sort of evolved away from natural foods and sources of vitamin D. So of all the things that we put inside our body, that is one of those things we have to be extremely mindful of. So have you checked your vitamin D levels recently?
No, never. I think I need to get all the things checked, to be honest with you.
Yes.
The doctor would agree. I think I've been low, but I do supplement with vitamin D. We do try to get outside. Can you have too much vitamin D?
Yes, you can.
Okay.
So, you know, you can get kidney stones because it's involved in calcium metabolism. So some people say more is better. Not in this case. It's just a Goldilocks vitamin D. You want just the right amount of vitamin D because it obviously protects with cognitive health, with cardiovascular disease, but if you get too much, it can cause all kinds of problems. Now, how much weight we have on us can also affect our vitamin D levels.
Okay.
So it's not just a one-time thing. You check it once and you say, I'm good. If you've added a lot of weight or lost a lot of weight, that can also affect the way that your vitamin D is expressed in the body, because fat is actually a depot for vitamin D. So the vitamin D is fat soluble, it kind of sits in your fat, so it can change the absorption. If you have osteoporosis or thin bones, especially if you work out a lot, you want to be really mindful of your vitamin D, because it can cause those bones to be brittle, break, and have more injuries.
Clearly, everyone needs to get their vitamin D checked, probably annually, really.
Thank you.